Hi, I'm Doc Jenny. Join us in the Green Hornet as we travel the backroads of beautiful North Idaho. Every day is different, challenging, and never boring as we see all the farm animals, big and small. Hey everybody, this is Doc Jenny. Hey, we are going to talk a little bit about nonsteroidal anti-inflammatories, commonly called Nsaids. They're something that every horse owner should be familiar with their use and should work with their veterinarian anytime that they are using it so that they know that they're using it properly and using it for the right things and that we're not overdosing the horse. So non-structural or non-steroidal anti-inflammatories are a class of drugs that all work to decrease inflammation within the animal. So they can be used on multiple species. The kind that we use on horses specifically, there are few that are very common in the horses that we use. So probably the most common one that many horse owners will use is phenylbutazone. Phenylbutazone has been around for a very long time. It's a very common anti-inflammatory, and it comes in several different forms. You can have this paste tube, which is a nice handy one to pack with you. The only thing I don't like about this thing is that this tube is so unwieldy. It can be kind of hard to squeeze, these great big tubes. This is a USDA, FDA approved one, so it's a non-compounded product, which is important. We have been asked at any time that there is a product available that is that has an NDC number on it, that we're using that in place of the compounded one. So all of these drugs that we're talking about today are the approved form of the drug, non-compounded. So this tube is dosed out into grams. Each line on here is a gram, and it has a dial that you dial it down. So it's really important with the bute because this is 20 grams of bute, and the most generally that we're going to be giving to an average size horse is 2 grams. So if you fail to dial this down and we're just going to administer it hoping you could stop at 2, the good news is that this is really thick, you'll probably be able to, but I have had people call me in a panic because they gave way too much, or that somehow the dial slipped or they didn't have it adjusted properly. So you want to make sure that you have it adjusted to dose out properly. This would be a 1 gram dose here. So you can see it's pretty small. And then you can either dose it by slipping that into the horse's mouth and pointing it towards the back of the mouth to give it, or one of the other ways I will often give this particular drug is I will squeeze it on my finger, because it's hard to squeeze out of there. So I'll squeeze it on my finger and then I'll just stick it right inside the horse's mouth. So that's a little handy trick if you're using this particular form of bute. These all do have expiration dates on them. You can find the expiration date on either the tube or the box. I think this has it on the end of the box here. But it's right here on this tube, and it expires in 01 of 21, so it's got a fairly decent shelf life. That's if it is kept at the proper temperature. So if it gets too hot or if it freezes, then I would consider that particular expiration date to be void. So with the bute, I will use the bute past its expiration date. The worst that's going to happen is that it's not going to be very effective. If the bute's not very effective, generally that's not going to be an emergency. Typically with the bute, we're using it for musculoskeletal pain or lamenesses. So it's to help the horse with some pain that way. We'll occasionally use it for eye issues and things like that, but generally bute is the one that you're going to reach for if you have a horse that's limping. The standard dose for bute is 1 to 2 grams, either once or twice a day. And you don't want to ever go over 4 grams a day for more than 4 days. So this is one of those that can cause ulcers in the gastrointestinal tract, so it's important that we don't overuse any of these products. Bute also comes in a handy dandy powdered dose. So this comes with a scoop. Each scoop is 1 gram, and that can be added to some grain. So this, for some people, this is a much easier way. Most horses like this flavor. If you have a picky one, this is orange flavored. I don't know why they chose orange for the horses, but they do seem to like it. Most of mine will eat the bute that way. Or you have the old-fashioned tablet form. These are 1 gram tablets. They do also come in a 500 gram or 500 milligrams. You want to know what size tablet you have. This is a fairly large pill. This is pretty bitter, but you can crush that up into a powder and mix that with some grain. Some horses, I've been told, will eat just the tab by itself. So it just depends on owner preference for which particular form of these drugs that you like. I do like my owners to have a little bit of these products on hand, especially for minor aches and pains and things that we maybe not an emergency, but we can't get to it right away. So if you have a horse that's limping a little, I may say, have you tried a little bit of bute? Generally, I like to know when my patients are on these medications so that I can help to guide you and make sure that we're using it properly and not giving too much. The next one that we'll commonly use is called Banamine. Bandamine's kind of like Kleenex. It's the brand name for it. The drug name is flunixin-meglumine. This is an off-brand called Prevail, but you can see here that it is flunixin-meglumine. This is an apple-flavored paste, and it's dosed out by 1,000 pounds. And so each tick here is going to be 250 pounds. And so a full dose for a 1,000-pound horse would be here. And sometimes we'll give the half dose, which would be a 500-pound dose, would be here. Again, you're going to dial it down and make sure that you have it dosed out properly so that you're not overdosing the horse. Just like the bute, these overdose of these drugs can cause systemic problems, so you want to make sure that you're using them properly and that we're seeing the response to these drugs that we like to see. So if your horse is not responding, again, we need to be aware of that. So anytime I have a client that has a horse that's having problems, they'll call me and I'll say, all right, do you have any bute or Banamine on hand? And then we'll talk about what dose that we're going to give, what results we expect to see, and what to do if those don't happen. So this Bandamine also comes with an expiration date on the end of the tube here. And this is really important to know that if your Bandamine is within date or not. If it's kept inside at a good temperature, you can probably use it. You know, Bandamine doesn't know what the date has been. This is what the drug companies have decided is the expected efficacy of this drug, and that the drug they know will be effective to that date. But again, the Bandamine doesn't know that date has passed. So I don't have a problem with you using your Bandamine a little bit past date. But the one problem we have with the Bandamine is that if you do use expired Bandamine or Bandamine that has frozen or anything like that, and it doesn't work, then we don't know if it's because the drug wasn't any good or the horse didn't respond. So with the Bandamine, I consider it cheap insurance. It's important that you have Bandamine within date on your in your emergency kit. And again, if you do need to use it, rather than waiting a couple hours after you've used it to call me, we like to know that you call me up, say, hey, I've got a horse that's colicking. I'm going to give it a little bit of Bandamine and watch it, and then we know whether or not we need to come right away. Bandamine also comes in a liquid form. This injectable form, it can be used IV. You can also use this orally. This cannot be given intramuscularly, even though it still says that it is approved for intramuscular use on the bottle. Bandamine has a high incidence of a complication called clostridioidomyositis. And so if an injection is given into the muscle and the horse reacts to it, it can cause a potentially deadly infection in the muscle where the muscles just kind of necrotize and fall off. Those of you that are on social media, you've probably seen those horrific posts going around where the horse has to actually have the muscles cut open and drains put in, and it's a nasty, nasty thing. So if you're going to be using this liquid form, which is a little bit cheaper than the paste, you need to make sure that this is kept from freezing, that it's kept inside at a consistent temperature. And if you are not giving it IV, if you're not qualified to do that or comfortable doing that, then I would use it orally. All right, so that's it for the Bandamine. The other one that we're going to talk about today is Equiox. So this is also a non-steroidal anti-inflammatory, but this is in a different class than these two because this is what we call a COX-2 inhibitor. What that means is that rather than causing broad anti-inflammatory response, this one's going to directly inhibit the COX-2 formation in the inflammatory cascade. When that happens, it doesn't have the same ulcerogenic effect that can happen with these particular drugs. So the Equiox is one that I'll use for an animal that needs to be on anti-inflammatories for an extended period of time. It's a fairly small dose that we end up using. This Equiox is a Again, this is proved directly for horses. There's one, it's hard to believe that this has this much effect, but this one tiny little pill can be given once daily for a 1,000-pound horse. It's labeled specifically for arthritic pain, for osteoarthritis pain. And I really like this one for those little minor aches and pains, especially in your performance horses, just to keep them feeling good and working at their best. So those are our 3 main options. There are other anti-inflammatories and pain medications that are available out there in the class of non-steroidal anti-inflammatories, I guess with the exception of aspirin, which we don't use very much in the horses. These are the 3 that we're going to carry on the truck and that we use most commonly. So thanks for tuning in, and we hope that you follow us along on all of our adventures out on the road. Hey everybody, thanks for riding with us in the Green Hornet today. This is Doc Jenny signing out. If you like what you saw, be sure and follow us in the Green Hornet with Tormund, out on the road with Doc Jenny. Just click the link below and follow us along on our journeys. See you later.